how do pharmacies work with a prescriber?
Pharmacists provide the opportunity for doctors to provide treatment with methadone and buprenorphine for heroin dependence without patients having to come to a public clinic, which is a great thing. Pharmacies are out in the community, they provide treatment to everyone. It's far less stigmatising, far kind of more normalising for people. They're open longer hours, you can get takeaways, and your pharmacist can become someone that is another source of professional support to you.
We see patients very regularly, usually 3 or 4 times a week, and it's quite easy to detect changes in the way the patient presents, and that early intervention of going back to the prescriber and having the person reassessed and put back on track makes it a lot easier process for people to feel comfortable that they won't be judged, but we're in there for the long haul and for their benefit. There are times when the advice sought by the patient may be in addition to what they've already received. It could be simply acknowledging them as people with a genuine need and responding to those needs. That becomes an important way of raising their self-esteem. It may well be that the role we play is reinforcing what the doctor has already told them about the safe storage of their takeaways, or even a common problem is managing their dental care. And all those are added together to form a relationship between both the patient, the prescriber and the pharmacist to the benefit of the patient, we hope, in the end.
Pharmacists and pharmacies are a great source of good information on all aspects of healthcare, not just for people with drug and alcohol problems. The major communications that I have with pharmacies that are involved in delivering treatment to my patients are that they provide a source of information to me as to how my patient's going. Have they missed any doses? Have you had to refuse providing any doses because of concerns over intoxication or other behaviours? Are they paid up to date? Have you got any concerns about your provision of treatment with them? And very often, the information I get given by my pharmacists is that patients are doing really well. They're a delight. They cause no problem. Everything's going well. So pharmacists are able to reassure me that patients who I might not see very often are doing really well.
And it's important for your safety that the pharmacist lets your prescriber know how well you're doing, how you're looking when you turn up to get dosed, how you're looking after you return after a period of takeaways. And while that might feel intrusive, these are really communications that happen because of your own safety. Even things like the pharmacist may need to let your prescriber know about prescriptions that you might be getting from other doctors. Again, that feels intrusive, but if it's dealt with respectfully and with trust with your prescriber, then you really will come to understand that that's an important safety communication.
And pharmacists legally can only dispense medication as directed by doctors. If there's no takeaways on the script, a pharmacist can't provide them. If the script says 50 milligrams, that's what the pharmacist legally has to dispense. And because of the concerns that we have about a very small number of patients diverting medication, the other thing that we ask pharmacists to do is supervise the medication. For buprenorphine, that might involve asking patients to remain in the pharmacy until the tablets have dissolved. For methadone, it's a fairly simple process. Somebody swallows their methadone and you have a very quick conversation. And if they go like that, you probably think they haven't swallowed it. So they're the sorts of roles that pharmacists have.